Paton, go ahead, and I'd like you to share your comments with us this morning. I think this is coming from the heart of people that these illnesses really affect.
Good morning. It's a great day in South Carolina. I'm just a little overwhelmed, but I would like to say I'm so thankful for Tim Smith from the Greenville News, because he's done such an amazing job. Google him and his stories in the last month, and I'm going to get to that in a second. But so I don't get off track, I'm just going to read what I prepared. It's an honor to speak to you on this raining, beautiful. We embrace humor as healthy. It's one of the principles of support. And what I believe to be a historic day for the state of South Carolina. The reason today is so important is because we as mental health advocates are here to send a message to South Carolina and the world that the mental health system in our state is flawed, and we're ready for a major change. Make no mistake though, change is coming and is happening as we speak. Recently, as many of you may realize, the very Honorable Judge Michael Baxley issued a ruling to try and clean up the horrible and unconstitutional conditions for our mentally ill who are serving time behind bars. Many here today and some around the state and even the country are now aware that this is not a new problem. This has been going on for 15 years. It was a crisis then, and it's a crisis now, and it's a crisis that needs to be brought to an end. Hopefully, the Department of Corrections got the message. They and Nelson Mullins law firm are currently trying to address the changes Judge Baxley outlined in his order. Our job is not done, however, as we need to let our elected leaders know that we are watching to make sure that a comprehensive plan is developed to correct the problems, and that legislators are going to provide the funding to make this happen, and so that this ruling can take place. I'm not going to read it, but this is a letter from, I started a foundation called Rehinge. I quit an 18-year career as an arborist. Rehinge.com, I encourage you to go look at it. You can share your story there. I'm trying to dovetail with NAMI and Mental Health America. But this was a letter from an inmate that I got 3 days ago in Florida, who said when he read my story on the NAMI website that he was afraid of the police too. And now he's doing 15 years. And he said nobody in his whole case understood what he went through. He's been fighting mental illness, schizophrenia for 40 years. This represents a lot of people. So we are here today to challenge our leaders and to educate them on the systemic failures of our broken institutions and encourage them to take action. We're here to come together and realize just how bad mental health crisis is in South Carolina and how much we desperately need more than lip service from our leaders. Again, we're here to make a change. I have been asked by members of NAMI to mention that I also speak for so many people that are unable to be here today. As someone who lives with bipolar disorder, I speak for the man or woman who is behind bars this morning because of a medical problem they didn't have a handle on. I speak for those who are in the middle of a crisis right now or in a hospital and can't seem to get a recovery plan that works well. I've been behind those bars. I've been to the point of suicide. I've been to those hospitals. I've had times without any hope. I want to tell them and you though today, there is hope, and that together we can work to make conditions of those in need much better. We wonder why these illnesses, which occupy more hospital beds than heart disease and cancer combined, are given so little attention to research and treatment. Any organ can suffer in the body except the brain. The brain is the only one that has a stigma attached to it. I'm tired of it. Because of the lack of funding and leadership from our elected officials, the steps toward deinstitutionalization for the mentally ill actually led toward reinstitutionalization, mostly in prison and jails. We have reduced the number of hospital beds for mental ill patients from over 600,000 in our country to 40,000, down to 40,000. We have now moved more than 1.2 million people with a mental illness behind bars. 200,000 of them are men and women that served our country, most who suffer with PTSD. The largest mental health facility now is #1, the LA County Jail, #2, Cook County Jail in Chicago, and #3, Rikers Island. This are mental health facilities in America today. We gotta educate people.
Let me check your hair.
We have to educate people because people don't realize the crisis. If a plane crashed every day with 100 people on board, we'd be all over it. 100 people will die in the next 24 hours from mental illness in the case of suicide. We're not more dangerous than anybody else, but we're 4 times more likely to be a victim of a crime. The leaders of our state plan on spending more than $1 billion in the next 10 years on our roads. I'm for that. Where's the $1 billion plan to invest in one of our most vulnerable populations, those who suffer from mental illnesses? I like smooth roads as much as the next guy, but I would rather have a few cars break down than a human being to the point of death at times. The time for action is now, and I'm asking you to make calls, write letters, speak to your neighbors, and fight stigma. With your help, we can make real change. I prepared a document with every legislator in our state, every address for their office, every phone number, and every email. And I got 250 copies here today. I encourage you to take this and call whose district you're in today. It is my firm belief that with our combined actions, South Carolina can become a model or an exemplar for the rest of the country on how to improve and turn around. We have a history right over here, one of the first mental health institutions in America. I learned that from Mr. McGill. It's powerful what could be done in this state. Thank you for allowing me to speak. My name is Paton Blau. I'm honored to be here. I'm honored to have people in this crowd that have helped me in my recovery process. NAMI gave me the 2011 Recovery of the Year award. I work with CIT. This is my passion. And there's no more fulfilling thing ever in life than to make the decision to do this for the rest of my life. Thank you.
Thank you, Paige. Thanks, Paige.